I'm Dennis Bragg in the Bitterroot. While the availability and need for COVID boosters continues to cause some confusion, Ravalli County health authorities say guidance is becoming clearer and shots are available. Like most Montana counties, Ravalli County has been coping with high case numbers in recent weeks, although it appears to be leveling off. However, there's also a gap in numbers because of home testing.
It does say on the box to please call your local public health if you have a positive, but I don't think we're capturing that data. I think that, it's very few and far between that people actually call and tell us that they had a positive test. So it's hard to account for those.
But based on the latest observations, Weber tells me indicators remain stable, including hospital capacity. Perhaps the larger issue has been helping vaccinated people sort through the emerging info about booster shots. But she says that info from the Department of Health and Human Services has been clarified, including last week with the boosters for Moderna and Johnson & Johnson vaccines.
The Moderna is pretty much the same as the Pfizer, except for that it's a half dose. Not that anyone needs to really know that, but it's the same recommendations, the 65 and older, especially if you live in congregate care living centers, anyone who's immune compromised, anyone 18 plus that's either got a qualifying condition or is in a high risk area for profession.
But boosters and vaccine for first-time shots remain available throughout Ravalli County, whether at local pharmacies or the health department on Tuesdays. And labeling isn't as important as it was last spring.
The new recommendations for this booster, you do not have to stick with the same vaccine that you got. So say if you got a Johnson & Johnson, you can come in and get a Pfizer or a Moderna. Now, it wouldn't be like a 2-dose series. One more dose, they would consider that fully vaccinated.
And what about shots for kids? Still a ways off.
That dosing is going to look different. So it's the same vaccine, but the dosing is going to be different. The packaging is going to be different. So at the moment, nobody has any pediatric doses yet.
And while all this is sorted out, Weber still advises personal responsibility, getting your first vaccinations if you choose, wearing masks when out among strangers, and following that guideline of staying home whenever you feel sick. In the Bitterroot, Dennis Bragg, MTN.